Romania has one of the highest COVID-19 death rates in the world. What will it take to stop the spread of the virus in a country where thousands are against containment measures, including vaccinations? Nearly 400 Romanians are dying from the virus every day. The health system is collapsing. Ambulances are queuing outside hospitals already at capacity. Some COVID patients are being transferred to neighboring Hungary for treatment. Welcome, I'm Ben Fazul, and another point we should point out is that Romania has one of the European Union's lowest vaccination rates. Only a third of adults are fully vaccinated. With over 16,000 daily infections, the President has described the situation as catastrophic. In rural areas, vaccine hesitancy is strong, especially in the southern town of Găiești. DW correspondent Fanny Facea paid a visit to an area where hospitals are overwhelmed and understaffed.
The more rural it gets, the more people are reluctant to get the jab in Romania. We are in the town of Găiești. There are currently over 90 COVID patients in the local hospital and only 4 doctors. Laurențiu Belușica is one of them. His enemy, time. He takes us to the red zone. We film with the hospital's phone to reduce the risk of contamination. Inside the red zone, there is a lack of everything, especially oxygen.
I need 150 every day.
And how much do you have?
25?
25 every day.
I think, yes.
He and his team can do little for the patients. There is a lack of medicine and personnel. 95% of those who end up here are unvaccinated. Many die. Rural areas in Romania have been hit hard by COVID. But there is little trust in the vaccine or in the government. Conspiracy theories are rife and reasons to refuse the vaccine vary.
I'm not vaccinated. I am against it because I don't believe in the virus. I didn't make a decision yet. I'm waiting. I don't know for how long. Some months.
A dramatic upsurge in cases and a rolling average of 300 people dying each day. More people have turned up at vaccination centers in the capital Bucharest to get their shot. But it's not enough to turn the situation around. Currently, only 1/3 of the population has been vaccinated. Romania was off to a promising start, but vaccinations slowed down, exposing millions to the virus. About 14% of Bucharest's population is infected with COVID-19, and that number keeps rising, especially amongst the unvaccinated population. Now, despite that, many people remain skeptical of the vaccines. State officials want to find a way out of the crisis, but how?
Right now, what we can do is to highly increase the vaccination rate. For instance, if you get vaccinated with a vaccine that is administered in one single dose, that means that in 14 days you'll be having maximal immunity.
For Laurențiu Belușica and so many chronically underfunded hospitals, it's all too little, too late.
I'm tired. Tired. Maybe. Not maybe. For sure. A little discouraged.
Belușica maintains the pandemic is still not being taken seriously by the authorities.
We don't have enough oxygen or funds for medication, and soon the 5th wave will be here.
The ambulances continue to arrive with COVID patients, even though there aren't enough beds to take care of them.
Well, Radu Timcu is intensive care chief physician at Floreasca Hospital in Bucharest, the biggest emergency hospital in the country. What is it like on the front line of this battle? What have you experienced with patients who've turned down the vaccine but end up in your hospital in a serious or life-threatening situation?
It is very sad to see a lot of patients coming to the hospital with severe form of the disease, and we know that more than 93% of the patients admitted in the ICU were unvaccinated people. Unfortunately, in these 4th waves of COVID disease, we have a lot of young people that come in the hospital on Sunday, we admitted in the ICU a young male, 29 years old, with a severe form of COVID-19, unvaccinated. The patient required intubation and mechanical ventilation. It's very sad and frustrating for us to fight against this disease, but unfortunately, the patients that develop severe form are totally unvaccinated patients. It's very, very sad because now we have the opportunity to stop the pandemic in Romania, but we don't use the vaccine because we don't trust in existence of the virus. We don't trust in vaccine. We trust in the conspiracy theory, and that will increase the number of deaths, unfortunately.
Did that guy manage to survive?
Yes, he is still in the ICU, intubated and mechanical ventilated. He received antiviral therapy, and we hope that we can save him. But this patient is in this situation because he was unvaccinated. We know from now that all the patients who develop severe disease are unvaccinated. And we know, unfortunately, only 20% of patients with age more than 80 years old were vaccinated in Romania. And we know this kind of patient will develop for sure a severe form of COVID-19 when they will be contaminated with the SARS-CoV-2.
And the fact that Romania has one of the highest COVID death rates in the world isn't enough to convince the doubters?
Yes or no? We observed that in the previous days. A lot of people want to be vaccinated, but unfortunately still 40% of the population, they are not convinced about the benefits of vaccination. But we pay a huge tribute to convince them to be vaccinated. More than 400 people die every day here, and it's a huge pay to convince people to be vaccinated. Because in a summer holiday, we have a very good situation, and a lot of people can come here to be vaccinated, but they refuse to receive the vaccine.
But winter's coming now, and the hospitals are not well equipped. You've worked abroad. How is the situation there? Because some health professionals call the situation depressing, and I don't know, I wouldn't want to catch COVID and then end up in one of the hospitals there.
Difficult because our critical care beds are fully occupied now, and we have a lot of patient remains in the emergency department and stay there for 10 days or longer to wait a bed for the ICU. It's very difficult because our national capacity in the ICU it's a little bit more than 4,000 beds, and now we use half of this capacity to treat a patient with COVID-19, and the rest of the beds, 2,000, we use it to treat all the patients with all the disease. And it will be very difficult if the patient with COVID-19 will increase in the next period because they will because we need more capacity to treat this patient, and unfortunately, a lot of other patients will come with difficulty in the ICU.
Okay, you heard it from Radu Tinku, Romania's Floresca Hospital there. Thank you very much for being on the programme today. Over to Derek Williams now for another of your questions. A good one if you're keen to get back on that treadmill after recovering from COVID.
How long should I wait after COVID-19 symptoms disappear to resume exercising?
This is a tricky question because while there are obvious health benefits to exercise, there are also potential hazards involved in starting to work out again too soon after an illness, especially if you were seriously sick or are experiencing longer-term effects. And we're still learning about the hazards associated with post-COVID health. So this is a decision that definitely needs to be made in consultation with your doctor. That said, I did read some cautious study-based advice from, for example, the Mayo Clinic that says that if you test positive for COVID-19, but then had only very low-grade symptoms or no symptoms at all, you can start with basic low-level stretching and muscular exercise about a week after your symptoms subside, and then slowly work your way on from there. But don't push it. What I highly recommend for anyone who's recovered from COVID-19 is to read a leaflet on rehabilitation that's published by the World Health Organization, which provides some excellent advice and simple rules as you try to strike the right balance between getting back in form as quickly as possible, but in a safe way. The leaflet also illustrates a series of basic exercises that anyone can do with very little equipment, so they can be performed almost anywhere. As I said, though, make a plan with your doctor and bear in mind that no matter how ill you got from COVID-19, it's going to take time, maybe a lot of time, to get back into the shape that you were in before you caught it.
After what we heard from that doctor in Romania earlier, healthcare workers must be exhausted from the pandemic, and another stressful winter is definitely not what the doctor ordered. That's why hospital staff in Austria gathered to protest for a higher vaccination rate, with messages like, "We are at the limit, get your jab," or facts instead of fake news. They prompted their fellow citizens to do their part in easing the crisis. Nice to have you along. Stay safe and see you again soon.